friends. I'm Dr. Ratna Ahuja, Senior Consultant in General and Laparoscopic Surgery in Apollo Hospital in Noida. Today I'm going to talk a small talk about giving awareness about a very common surgical problem called hernia. Let us discuss hernia at various with various aspects about like what is hernia and what are the symptoms of hernia, how to diagnose hernia, and how to treat hernia, complications of hernia if not treated, the treatment options, and the latest advances in the treatment of hernia. See, what is hernia? Hernia is an abnormal protrusion of an internal abdominal organ. For example, like an intestine or a layer of fat through a thick layer called a fascia or a sheath, which keeps all over the thick layer. That's a whitish thick sheath-like layer, which keeps all our intra-abdominal organs tightly packed inside, without which we all will be walking around with our internal organs hanging around. So actually our abdominal wall is made of a complicated, its anatomy is very complicated, which is made up of multiple layers of muscle, and this thick whitish layer is called as a fascia or sheath. So the hernia occurs where the fascia, that the thick layer, is either deficient, or maybe it is not supported by the muscle layers, or maybe it is defective due to maybe a previous open surgery. So through when this because of this that deficient site, that internal organs start bulging out. That what are the symptoms of hernia? So usually patient present with abnormal bulge, like on straining maybe for stools or for urine. All that I'll come later. That depending the patient usually present with an abnormal bulge in the abdominal wall, like at a site, depending on the type of hernia. If somebody presents with an abnormal bulge at the belly button area, or maybe near the belly button area, then it is called an umbilical hernia. If a person presents with a bulge at groin area, which is the groin area, that where the abdomen meets the thigh, then it is called an inguinal hernia. Or sometimes maybe at the site of a previous open abdominal surgery, then it is called an incisional hernia. So many people don't even realize that they have hernia. They keep on carrying it for many years. They notice only when it starts bulging out while straining. So why do some people let me talk about what are the causes for hernia. Why do some people tend to develop hernia? There are few factors which are the causative factors in causing hernia, like chronic straining. This straining causes increased intra-abdominal pressure. That maybe the straining is for stools. People with chronic constipation, they keep straining for stools. Or maybe a male person with a prostatic enlargement can keep straining for urine. Or maybe chronic cough in a chronic smoker, or maybe an asthmatic. They keep getting the chronic cough. So all these factors increases the intra-abdominal pressure, and this fascia over a period of time gets thinned out at places and develop hernia. See, second reason maybe when as I said already, when a patient undergoes a major open abdominal surgery, that area they can develop a hernia. But that is once there is a cut is made on the abdominal wall, it is no longer like a original abdominal wall. over a, for any reason, over a period of time, like this stitch line either thins out or may just break out, usually due to a chronic, if a person has chronic, constipation or cough, or maybe the person suddenly puts on too much of weight. All these factors can keep on stretching this stitch line, and over a period of time it gets thinned out, or either it breaks and can develop hernia. There are other reasons also. A newborn baby can be born with an umbilical hernia, that belly button hernia. Usually it closes automatically. In case if it doesn't, then it needs to be operated. At the same time, like a newborn baby can be born with an inguinal, that's a groin hernia, then it is called a congenital hernia. This doesn't usually closes on its own. This needs to be operated. So, and ascites. Ascites is a fluid collection inside the abdominal cavity. Here also it is like a obesity, that abdominal walls keep stretching out and the fascia also stretches out and gets thinned out over a period of time and can develop hernia. And aging people, aged person's abdominal wall is weaker than the normal person because of the change in collagen composition. So an aged person also can get hernia. So how to diagnose a hernia? Many of the people don't even realize they have hernia. They don't come unless they notice a bulge, especially while straining, or occasionally pain at the site of hernia. So they come with this to a doctor, and it is to diagnose a hernia. Usually you don't need any investigations. A doctor in OPD can easily diagnose a hernia, but sometimes we do like a ultrasound scan of the hernia in severe hernias, or maybe sometimes to see the content of the hernia, or when we plan for a hernia surgery, we do an ultrasound before surgery. And also occasionally we need to do a CT scan of the abdomen to delineate other factors, not for a diagnosis of a hernia. And now I would say a few words about the complications of hernia if not treated. See, I already said many of the patients keep on delaying the hernia because they don't even realize that sometimes they don't even realize they have a hernia. Or maybe a person with a large hernia, large gap in the abdominal wall, large defect we say, they usually don't have many symptoms. They might have, they will have just a swelling, or maybe they will have a mild irritation at the site of the hernia, or maybe, mild discomfort, some dragging feeling, or they can have occasionally back pain also. And they tend to ignore the hernia, and, they come to a doctor only at the time of complication. Or sometimes the patient is forced to delay the hernia due to some, family major events like a wedding coming up in the family, or maybe some may not get leave from work, or maybe some financial. Not everybody has health insurance cover, so people sometimes tend to delay the hernia because of financial constraints. So, or maybe they have some medical problem, somebody with a more serious coexisting medical problem, which might need immediate attention, like someone with a cardiac problem, or maybe cancer problem. So that might need an immediate attention. They tend to delay the surgery. So what are the complications in that case? Most of the all these patients, when they develop a complication, they tend to come to the hospital. The complications are over a period of time that that the intestine which comes into your hernia, and slowly at a time they may not go back into your abdominal cavity. Otherwise, usually in simple hernia, once they lie down, they tend to get back into the abdominal cavity. So later on, the stage comes when this intestine which is protruding out may not go back into the abdominal cavity. So that we call it as obstruction. So when they come with an obstruction to the emergency, we say immediate surgery. So otherwise, like if they don't even come at the stage of obstruction, if they come even later, that is strangulation, and later on obstruction, like disconnection of blood supply to that part of the intestine which is protruding out, then that we might need a different kind of surgery. In that case, that part of the intestine, if it is dead, then it is a major surgery, open surgery, and here we will not be able to do a very good hernia repair. We will be forced not to use a mesh, which gives usually a tremendous result, success rate. So I usually say that it is better that one should get operated when when they have time, rather than getting operated when they have complications, emergency. Because like sometimes you might be like traveling, you might be in the remotest area during your holidays, where you may not even have good medical facilities. So it's always better to get a hernia operation done as an elective procedure when you have time, instead of waiting for complications to develop. See, what are the treatment options of hernia? So sometimes the patient comes and tells the doctor, doctor, I want only an open surgery. Or maybe they say that I want only a laparoscopic surgery. We cannot, the type of surgery a surgeon offers usually does not depend on what the patient demands. Usually the type of surgery the surgeon chooses depending on the type of hernia and overall condition of the patient. It can be either open surgery or laparoscopic surgery. In an open surgery, what we do is we make a big cut on the site of hernia, and whatever the content, that is, like I said, the intestine or whichever part is protruding out, is pushed back into the abdominal cavity, and that the hernial margins or the defective margin is closed with the stitches, and over which this is a weaker part of this weak part of the hernia. So this weaker part of the hernia is strengthened by keeping a mesh, or it is like mesh is like a net-like material made of polypropylene, which is an inert material, which means it doesn't cause any foreign body reaction usually. And this mesh is fixed onto that weaker area with the stitches. And this other surgery is a laparoscopic surgery. Since last more than 2 decades, surgeons have been doing mostly laparoscopic surgery if a patient or the hernia is suitable for this type of surgery. In this laparoscopic surgery, we don't make a big cut, where what we call it as a keyhole surgery or a minimal access surgery. We make just 2 cuts, one 5 mm cut, that means half a centimeter cut, through which a camera goes inside, and the other 1 centimeter cut or like 10 mm cut, through which we put, introduce mesh inside the abdominal cavity. Here, what we do is like, the intestine, whatever the part is like protruding into the hernial sac, that we pull it back into the abdominal cavity. And sometimes we need to suture that gap or the hole that's a part of hernia, the hernial gap. Otherwise, like without suturing, we keep a mesh, and from inside we place a mesh and fix it. The advantages of laparoscopic hernia, most of you know, as we don't make a big cut, the hospital stay is much shorter. Then day after surgery, most of the patients get back home, and in an open surgery, the hospital stay is much longer. And as the cut is smaller, naturally the pain is much less compared to an open surgery. When the cut is small, you don't need an elaborate dressing. No bed rest is needed. The patient in an open laparoscopic surgery get back to regular activity from third day after surgery, and no need for then the chances of infection in a laparoscopic surgery is very, very, very less, like less than 1%, 1%, sorry. So, and but in patients who have a previous surgery, that's a recurrent hernia, who have already had a surgery for hernia, then we call it as a recurrent hernia. A patient with a recurrent hernia, there is no choice between laparoscopic and open. We need to do only an open surgery to get a good result. And how to prevent a recurrence? That is a recurrence of hernia after hernia surgery. See, I already explained to you the factors which lead some people to develop hernia. So here, to prevent hernia, you need to avoid those factors. That is, first of all, avoid increasing the intra-abdominal pressures by preventing chronic constipation. To prevent chronic constipation, you need to have a high fiber diet. That means plenty of vegetables and fruits, and plenty of fluids, like our 2.5 to 3 liters of fluid a day. In spite of these, in case if you continue to have constipation, then take prescribed laxatives. But you should prevent constipation, and you should prevent straining during urine. If a person has got a prostatic problem, because of which he has to strain during urination, then you need to fix that problem. You get treatment for prostatic enlargement first before undergoing your hernia surgery. And stop smoking. I always say that if a person comes, a smoker comes for hernia surgery, I tell them to stop before coming for surgery, because a smoker, they can have chronic cough. Apart from just chronic cough, collagen layer, that the collagen layer is like a cement layer, the tissue layer forms over your this mesh, that only forms a strong layer and supports that area and prevents hernia from recurring. So to get a proper healthy collagen layer, you should stop smoking before surgery. A smoker's collagen is not that stronger compared to a non-smoker. And I always say avoid putting on too much of weight post hernia surgery, because that if your abdominal wall keeps on stretching, that your hernia, you can tend to develop a recurrence of hernia. And to take high protein diet to get a good strong muscle layer, along with abdominal exercises to make your abdominal muscle layers stronger, and not to do excessive weight training post surgery. And I would like to conclude with a few lines on how to get back to normalcy post hernia surgery. And patient usually ask, do I need to take bed rest post hernia surgery? Because they hear lots of people saying, like, if you get back to activity, hernia will come back. But we surgeons nowadays suggest, no more suggest a bed rest. Actually, earlier you get back onto your toes, the better to get back, get back to normalcy. So post laparoscopic surgery, from third day they can get back to moderate regular activity, like inside the house. And from first week onwards, they can get back to outdoor activities like walking. From third or fourth week, they can even get back to jogging. And from sixth week onwards, they can get back to even more strenuous exercises. In an open surgery, I advise always to start doing muscle strengthening, abdominal wall strengthening exercises after 3 months of surgery, along with a high protein diet. Only this high protein diet, along with a abdominal muscle wall strengthening exercises, will give a good success rate in the long term. See, large abdominal hernias, I always advise not to do any strenuous activities, not even no lifting weights, and only do abdominal wall strengthening exercises along with high protein diet and deep breathing exercises and some cardiac exercises. And many patients ask, can I use an Indian toilet post hernia surgery? Yes, you can use an Indian toilet post hernia surgery. But in a laparoscopic surgery, post laparoscopic surgery, you will be able to do, use Indian toilet very comfortably. But after an open hernia surgery, you will find it little difficult due to pain. Immediate post-op, you might get pain using an Indian toilet. So I hope I explained well all whatever regarding hernia in short.